This is a presentation for the Don't Let Hepatitis B Win Perinatal campaign. We're going to discuss what viral hepatitis is, as well as why hepatitis B is a concern for Asian, African, and refugee communities, and we will also discuss how you can protect yourself and your family from hepatitis B and how to educate others. Although a safe and effective vaccine has been available since 1982, in many parts of the world, hepatitis B prevalence remains high. Across Africa and Asia, 5 to 10% of the population is chronically infected, and most of the transmissions within these regions happen from mother to child during pregnancy, in childbirth, or in early childhood. In the United States, 1 in 10 African-born immigrants is chronically infected with hepatitis B, compared to 1 in 1,000 non-Hispanic whites. More than 686,000 people die every year due to complications of hepatitis B, including cirrhosis and liver cancer. And 20 to 30% of adults who are chronically infected will develop cirrhosis and/or liver cancer. A staggering 95% of people infected with hepatitis B or C around the world don't know that they're infected, so this is why we can refer to this disease as a silent killer. Viral hepatitis is damage to the liver caused by a virus, and this damage can be caused by a number of different viruses, but the most common are the hepatitis viruses. And even though these viruses are not related, they all do similar damage to our liver. What does your liver do? Your liver is an important organ that does many different things. So chronic hepatitis causes liver inflammation, and this can have warning signs like muscle aches, lack of appetite, pain, jaundice, depression, or there could be no warning signs at all. And this can lead to cirrhosis, which is scarring of the liver, liver cancer, liver failure, and even death. There are different kinds of hepatitis, and the most common are hepatitis A, hepatitis B, and hepatitis C. The hepatitis A virus enters through the mouth, in food or water, or on hands that have come in contact with human waste. And it can be spread through close personal contact, and although people can get very sick from hepatitis A, they almost always get better. To protect yourself from hepatitis A, you can get the hepatitis A vaccine. Be careful where and what you eat. Make sure you wash fresh fruits and vegetables, and make sure you cook shellfish thoroughly. And also wash your hands before eating and after using the bathroom. Moving on to hepatitis B and C. Hepatitis B and C are spread by infected blood, sexual fluids, and from mother to child at birth. We'll spend most of our time discussing hepatitis B, however many of the things that we touch on also relates to hepatitis C, and I will point out those things. Most transmission happens from mother to child during pregnancy, in childbirth, or in early childhood, and this is called vertical transmission. You can also spread hepatitis B from person to person through horizontal transmission, so through sharing razors, needles, blood transfusions, organ donations, contact with the blood or other fluids of someone who has it, and unprotected sex with a hepatitis B positive individual. The way people get infected is similar for hepatitis C, although drug injection or past blood transfusion is a more common route. The most common transmission of hepatitis B is from mother to child at birth, so all pregnant women should get a blood test for hepatitis B as part of their prenatal care. A hepatitis B infection in a pregnant woman poses a serious health risk to their infant at birth. If hepatitis B is passed from mother to child, there is a 90% chance of developing a chronic hepatitis B infection, and 1/4 of babies infected will eventually die from chronic liver disease. Perinatal transmission can be prevented by providing the first dose of hepatitis B to infants within 12 hours of birth, and babies will need to receive 3 to 4 shots in total for protection. It is safe to breastfeed your baby if they receive the hepatitis B vaccine, and hepatitis B is not transmitted through breast milk. Hepatitis B is 100 times more contagious than HIV, because it can live for a week outside the body, and it can be found in dried specks of blood and other fluids, and it can also stick to tattoo needles, syringes, and injecting equipment, as well as toothbrushes, razors, and other tools. Also, a very small amount of blood can cause an infection, so it's important that we're not sharing these tools regardless of the length of time between use. Hepatitis B is not spread by casual contact like holding hands, hugging, kissing, sharing food, or drinking from the same glass, and this is the same with hepatitis C. When someone first gets infected with hepatitis B, they have what is called an acute infection, and this acute infection lasts 1 to 6 months with symptoms that include nausea, vomiting, abdominal pains, fever, jaundice, and feeling generally unwell. And symptoms of acute hepatitis B usually go away after a few weeks as the immune system either clears the virus or brings it under control. However, in about half of the cases, no symptoms or only mild flu-like symptoms develop in this acute phase. And you may not even be aware that you've been infected. In particular, babies who are infected from their mothers during childbirth usually have no symptoms at first. Following the initial acute phase, in more than 9 in 10 cases in adults, the virus is cleared from the body by the immune system within 3 to 6 months. In this situation, you're no longer infectious and you are immune to further infection. In up to 1 in 10 cases in adults, the virus remains long-term and you develop a chronic hepatitis B infection. And this can occur whether or not you had symptoms in the acute phase. In more than 9 in 10 babies infected from their mothers, their virus will remain long-term. Chronic hepatitis B is dangerous because there are often no symptoms, and blood tests for liver enzymes may be normal. And by the time symptoms such as abdominal pain and abdominal distension appear, it's often too late for treatment to be effective. So, do you see the problem? 2 people get the virus, one is cleared and has lifelong immunity, and the other, the virus becomes chronic. Both people can look exactly the same, even though they had different outcomes to the virus. Chronic hepatitis B is dangerous because there are no warning signs and you can't tell if someone is infected by looking at them. Only a blood test can tell you your hepatitis B status. A simple blood test can tell you if you're immune, chronically infected, or susceptible. Being immune means that you were exposed to the virus previously and fought it off, or that you've been vaccinated. Having immunity means you are protected and can get the virus again. A person can be immune to hepatitis A and B, but you cannot be immune to hepatitis C. Susceptible means you've never been infected with hepatitis B or C, or you need to be vaccinated against hepatitis B. Unfortunately, there's still not a vaccine for hepatitis C. You can protect yourself from hepatitis B and C by not sharing razors or toothbrushes, practicing safe sex and healthy hygiene, being safe with traditional tattooing, acupuncture, and other practices, and most importantly, getting vaccinated against hepatitis B. For the 90% immunity that the hepatitis B vaccine provides, you will need to complete the entire vaccination series, and the most common option is 3 shots over 6 months. The vaccine is made from the hepatitis B virus, but it cannot cause hepatitis B or make you sick. It is important to ensure that your children are protected. Babies born in the US are vaccinated against hepatitis B when they're born, but children born outside of the US should be screened for hepatitis B and receive the vaccine if they are susceptible. It is also important to protect your family and make sure they know their hepatitis B status and that they receive the hepatitis B vaccine if they are susceptible. Remember, you cannot tell if someone has the virus just by looking at them. The great thing is that there are several places to get screened. You can go to your family doctor, a neighborhood health center, other clinics and health department sites, and free community screenings. Staying healthy is important for you and your family, and by getting your recommended health screenings and vaccinations, you can live a healthier life. And these screenings include cholesterol, colorectal cancer, diabetes, and mammograms. So take action. Get screened for hepatitis B, know your family's status, get the hepatitis B vaccine if you are susceptible, ask a friend or family member to get tested for hepatitis B, and stay healthy with other vaccines and screenings. Thank you.